The 16th of May, Ukraine Media Center is on air. Your anchor is Svetlana Cheparenko. We are talking about the Hepatitis A cases outbreak in Kyiv. We are joined by Nataliia, Hunchenko, Deputy Director General of the Kyiv Center for the Disease Control and Prevention. Welcome, ma'am. I welcome you, ma'am. The news tell us that the outbreak of hepatitis A is throughout country, in particular in the capital city. What do you know about the statistics? As of today, for the morning of today, in the city of Kyiv, we have seen 65 cases, including 31 children. These cases have been registered in the Solominsky district of capital city. That is, the surge of the disease is taking place in a particular locality of the capital city, and that is the district of Vidradny. What do we know about the sources of the disease and the transmission routes? The hepatitis A outbreak in the city of Kyiv. Now, the sources maybe rather the foods, the water, and what we know for sure are people who are suffering from the disease without symptoms. This is the three routes that we are investigating. Since we know about the three ways of transmission and the sources, and we are working in those directions. As for the water, the virological hepatitis see a couple of stages before you see the symptoms, and it'll take time from 14 days, and the literature tells us up to 50 days. So what we are now investigating, we have informed the government bodies who are responsible for tracking the quality of foods. We have informed them that the situation is as it is, and they are talking to the operators on the market. For example, we are tracking down where the food comes for the children in the schools. Some children eat at school, some don't. And we know that school children basically eat in that particular district. We have also informed the Key Water Channel facility, people who are providing the water for those buildings, including the pump rooms in that district. In addition, on the 13th of May, we saw the commission meeting, specially organized, the Commission for Emergency Situation. And that committee have come up with a plan of action with different services. At the Kyiv Center for Prevention of Disease, we are called to organize prevention measures. What we did yesterday and the day before yesterday, there was a bus, and our virological laboratory and the specialists in epidemics also were providing information for the public. In that particular locality, we have engaged 2 hospitals with their specialists, and for all wishing to do so, we are providing express tests for the last 48 hours. This is one measure. And of course, we want public to be aware of the challenges. And there was a possibility for people who don't have their health declarations. People are complaining that they don't always have health declarations. So we had specialists from health institutions where people could be observed by doctors without their health certificates. We understand that the work must be continued, and that is raising public awareness, because people don't know the factors of how the disease is transmitted, what are the first symptoms of the disease. and that can't be overestimated. Many cases where we saw children going to school for a week or two, and they were actually already the carriers of the disease, and then in 10 days' time, they saw the symptoms and their children turned to the family doctors. So I take this opportunity to call out to the public that in that particular district, the announcements are made, the local facilities know about that. On Monday, the 22nd of May, we will resume our work with the public. In addition, a lot of organizations that are working in that locality send their employees to be tested. So we are working together with the healthcare facilities to make sure that we identify the disease and those who have already been sick as soon as possible. The symptoms are quite light as of now. It doesn't lead to jaundice always. We know from literature that sometimes these are suffered in a light form. So we are using different laboratory methods, and healthcare providers are working together. You mentioned about the express tests. Have you identified the sick? The first day saw 10 people that we suspected of being positive. We are testing them for different aspects to identify those who have already overcome the disease and who are currently sick with the disease. Of course, we do this with their concession, and then the PRL test will identify, and we have one positive answer, and we continue to work in that area. What are the identification of the disease, what we should be aware of, what is the specific of the hepatitis A as different from other. We have a lot of symptoms here. Hepatitis A, of course, it's transmitted through different routes. For example, dirty hands, low-quality water. The virus that we see is when the transmission is gone through mouth down to liver. Luckily enough, with all the different hepatitis types, this is the least dangerous. It is easy to cure. There is no specific methods of curing. There is a vaccine specifically designed for the hepatitis A. It is not a obligatory vaccination method, but given this emergency situation, the public are advised to buy vaccines with their own money to get vaccinated. We have seen vaccination in the amount of more than 300 people, majority of whom are children. And for the period of, it covered the period since the 10th of May, when the outbreak began. But that vaccination has to be paid for by the parents of the children. What is the price of the vaccine? For the grown-ups, it's north of 1,000 hryvnias and 800,000 for children. And it works for the period of half a year. Once you have been vaccinated, you have to be revaccinated in 6 months' time, and it'll last for 5 years. This is what we know from the medical literature. In Kyiv, half of those that have been infected are children. The virus hepatitis will affect all strata of society, but in particular, children are vulnerable, including grown-ups are until they're 30 years old. The majority of the grown-ups are protected, but most vulnerable straight are children. On their own, can people apply for the tests whether they're in the zone of risk or they have overcome the disease? As I've mentioned, the testing can be done in a number of ways. One thing is general monitoring of those who are wishing to go through the procedure. The other way to identify is that we suspect people of being ill. Again, the emphasis is that we are doing that free of charge. The second point is that we have laboratories with the family, doctors, and we apply to the enterprises and for their employees. We have seen two organizations providing samples of their employees to be tested. The healthcare providers take the so-called liver samples, where the analysis will tell whether people are subject to the disease. And the samples that we analyze are free of charge. You mentioned something of a mini investigation. What are the preliminary conclusions and what will be the final result of the investigation? What has caused the surge? I've mentioned that this disease takes a prolonged period of time, up to 50 days. We are now looking back into the sources. It's not that we can take the samples from water, from the pump rooms, from the water system. What we are interested in is what had happened 2 months before this. We are doing this research. We are identifying new data, and we continue with our tests, gathering different samples. Sometimes we see when the standards of healthcare are violated. There are some positive signs in our analysis of the water. We are working with the samples of water, and the work is continuing. So looking back, what we can say now is that we have to look into the situation that has been brewing for some time. What are the actions for the schools do you think should be? In this district, all the schools have been transferred into the online education. All the education is taking place online. We have a lot of children tested, and the youngsters and minors, and we were talking to kids to draw their attention that if the temperature is getting high, if your nose is running, no one really pays attention to that. And we tell children that you are not supposed to drink from one bottle of water. You can't share your sandwich with your friend. This is very dangerous in terms of transmission. This surge, is that a unique situation for the capital city, or such outbreaks are taking place year in, year out? Hepatitis A is something that we identify on a constant basis, but our analysis said that some years see the downfall and some years see the surge. We are talking about 7 to 8 year periods when we saw the surge of hepatitis A in Kyiv. There were some instances last year, 2 to 3 or 4 instances last year. That's why the situation is that we are constantly dealing with such a disease. Colleagues, do you have questions? Perhaps journalists might have questions to our guest. Welcome, Lilia Hunchenko from the Suspilne Broadcasting. When we talk about some preliminary estimates about the source of the outbreak, do you think that it's the food or the water? And then you mentioned the prevention measures that are taking place in the particular district of Vidradne in the capital city. Or do you think such a prevention campaign must be conducted throughout the city of Kyiv? Now, currently, as I mentioned, we have preliminary results, what we have received on the analysis of the foods. We have seen the violations of the sanitary regimes by the enterprises that provide food for schools. Another thing is the quality of water. We are now conducting a detailed and deep analysis of the quality of water. In general, in the city of Kyiv, the situation is stable. We have one or two examples, but they are not related. The general public must, and it is a must, to wash their hands. This is an elementary thing, seemingly. Another important point is that pathological agent is quite stable. So it is important, and we inform the public that the water must be boiled before you wash your fruit or apples or pears. And this is what we saw at the source of the disease. We know the source of the disease when the sanitary norms were violated, including 7 schools and 2 kindergartens. So we've done the disinfection campaign. So in general, in the city of Kyiv, the situation is stable. As for the prevention measures in other districts of the capital city, we are tracking the situation in the city of Kyiv together with the water providing authorities. We analyze all the previous instances, comparing the situation in this district with other districts in the city. In other districts of the cities, the situation is stable. There are some instances, but they are not related. Thank you very much. Do we have more questions? In that case, now, epidemiological situation in Kyiv, what is it in Kyiv? How about other seasonal diseases that we see? It's now the end of May, beginning with October up till May, we see the influenza instances on a constant basis. These are respiratory diseases that are connected with the COVID. This period has been quite stable. There were some lethal instances as a result of COVID. COVID has not disappeared. It's still going on. And respiratory diseases, including influenza, of course, as well as it relates to COVID, there are vaccines available, and the government provides such vaccination on a government level. They're free of charge. That is to say, this year has not seen the upsurge. The situation is stable and predictable. There were some periods, including some weeks, but the threshold has not been surpassed. Sometime back in March, we saw some anomalies, but the situation is being monitored, analyzed. Our laboratory conducts different testings because Kyiv is one of the 5 regions where we conduct an investigation. We have reference points. Why do we do this? We want to ensure that in the future we know what kind of viruses of influenza are here available in our region. Thank you very much, ma'am. We've been talking about the rise of the hepatitis A in Kyiv and other areas of epidemiological system. The Ukraine Media Center will resume our work next week. Stay tuned.